Hi everybody, my name is Dr. Biama Onya. I'm the director of the UPTH Lifestyle Medicine Center, and we are commemorating the International Women's Day. The theme this year is Invest in Women, Accelerate Progress, and that has to do with economic empowerment. But I can tell you that economic empowerment cannot take place when a woman is unhealthy. And we know that apart from sex-related or reproductive conditions that affect women, we have disease conditions that typically are more prominent, more prevalent in women. And lifestyle medicine is very important because it's at the core of preserving health and maintaining health. And so thereby preventing these disease conditions. So what are these conditions we're talking about? Osteoporosis, we're talking about breast cancer, mood disorders. We all know that most people with depression tend to be women. Then, of course, cardiovascular disease risk. We all know that most of the myocardial infarctions occur in women. And there's a reproductive risk. There's actually, latest research shows that those that have had small for gestational age babies, those that have premature menopause, or who have had hypertensive diseases in pregnancy or diabetes in pregnancy, are at higher risk of having those cardiovascular diseases. Sleep apnea has always been considered to be a disease of men, and that's because of underreporting of women. You know, they wouldn't want to tell you that they snore. But they do actually present in other ways, like they have headaches, they have anxiety, depression, all of that. One indirect measure of sleep apnea in women is daytime somnolence. It's identical with the results of people that are diagnosed with sleep apnea. And of course, you know the effects of sleep apnea on, metabolic health, the diseases, chronic diseases, increased obesity, hypertension, diabetes, and all of which lifestyle medicine is able to address. So why not? Why don't we discuss this? Now let's talk about lifestyle medicine and reproductive health. We all know that when you practice lifestyle medicine, it's actually a modality for management of infertility. But apart from that, there's something called epigenetic imprinting. And when you practice lifestyle medicine in your childbearing age, you tend to actually prevent, and treat and even reverse diabetes for yourself, and not just for yourself, but for your child and even for your grandchild, because this epigenetic imprinting actually affects even the fetal ovaries. So your grandchild may not have diabetes. Your child will not have it. Your grandchild may not have it. And as long as they continue with this lifestyle medicine practices, even their own progeny will not have it. So that is something that we should, consider when we practice this. We're not just doing it for ourselves. And these changes are heritable. That's one very important aspect of lifestyle medicine that we should take into consideration. We should also note that women are caregivers who care not just for their children, but for their spouses, in-laws, their own parents, grandparents, as the case may be. And for them to be able to have the strength to do that, as well as pursue their careers, and self-actualization, they just have to be healthy. And lifestyle medicine is something they have to imbibe. Now, in commemoration of this year's Women's Day, we have a 30-minute aerobic program at our gym at the UPTH Lifestyle Medicine Center, after which we shall discuss, the pillars of lifestyle medicine and the importance of embracing lifestyle medicine wholeheartedly in order to get the benefits, to derive the benefits and the dividends of health and well-being. Thanks and God bless.